You give your dog a dewormer to keep them safe. But what if the choice itself contains a hidden danger? For collies and related breeds, one of these top dewormers can cause severe neurological damage if not dosed with absolute precision. The risk is not one-sided. The other leading option, Drontal, is forbidden for pregnant dogs due to potential harm to fetuses. These aren't rare flukes. They are fundamental safety differences rooted in how these drugs operate and for which dogs they are intended. We'll break down the key safety checkpoints: breed, pregnancy, age, and health status, so you can have an informed conversation with your vet. So what's actually in these pills? The difference starts with the number of active ingredients. Milbemax uses a 2-drug combo. Drontal uses a 3-drug cocktail. Milbemax's key advantage is its dual function. It is an intestinal dewormer and a monthly heartworm preventative. Drontal, on the other hand, has a different bonus feature. It helps control the shedding of Giardia cis, a common protozoan parasite. This difference extends to puppies. Milbemax can be used from 2 weeks and half a kilo. Drontal tablets start at 3 weeks and a higher weight. But Drontal offers a liquid suspension formula, which can be a much safer and easier way to accurately dose tiny puppies compared to splitting tablets. Regardless of the formula, one rule is absolute for both. Accurate weight-based dosing is non-negotiable. Underdosing fails. Overdosing invites risk. Why are they so different? It's how they attack parasites. Milbemax's key ingredient, Milbemycin oxime, attacks the worm's nervous system, causing paralysis. A worm's nervous system. But what if a dog's own system is uniquely vulnerable to that same attack? This brings us to the MDR1 gene mutation. The MDR1 gene creates a protein that acts like a bouncer for the brain, pumping out certain drugs. In dogs with the mutation, this bouncer is broken. Now, Milbemax's nerve agent ingredient can cross the blood-brain barrier without being removed. It builds up to toxic levels, affecting the dog's nervous system. At the recommended dose, it's generally safe even for these dogs. But the safety margin is dramatically reduced. A small dosing error could be catastrophic. Drontal's ingredients work differently, causing muscle spasms or blocking energy metabolism in the parasite. It does not carry the same specific neurotoxicity risk. We've covered a critical genetic risk. But what about a temporary life stage, like pregnancy? Here, the safety profiles completely flip. Milbemax has been studied and is explicitly stated as safe for use in breeding, pregnant, and lactating dogs. This provides a clear green light. Drontal Plus, however, is contraindicated, meaning it should not be used in pregnant dogs during the first 2 trimesters. This is based on evidence. Studies at elevated doses of its active ingredients showed an increased rate of abortion and fetal abnormalities. The risk is simply too high. For expecting mothers, the safety data presents a clear choice between these 2 products, with guidance from your veterinarian. Beyond these specific groups, what happens if any dog gets too much? And what about dogs who are already sick? The answer may surprise you. An overdose of Milbemax predictably targets the nervous system, muscle tremors, lack of coordination, and sometimes seizures. A Drontal overdose looks very different. It's primarily severe gastrointestinal upset, like vomiting, diarrhea, and appetite loss. It isn't just about overdose. Both drugs have potential interactions. Milbemax with other macrocyclic lactones, Drontal with piperazine drugs. Of course, even at the correct dose, both can cause mild, temporary side effects like vomiting or lethargy, especially with a heavy worm burden. Recall how Milbemax prevents heartworm? That benefit carries a terrifying risk if you give it to a dog that already has heartworm, causing a massive die-off. And what about that question of already sick dogs? The hard truth is, there's a data gap. Neither product has been studied in severely debilitated dogs. This is why a pre-treatment vet exam is a critical safety step. Your vet assesses these hidden risks: heartworm status, organ function, and potential pregnancy. So the safest dewormer is not a brand name. It's a decision based on connecting the drug's mechanism to your dog's genetics, life stage, and overall health. Let's recap the 4 safety checkpoints to consider with your vet. 1. Your dog's breed and potential MDR1 status. 2. Pregnancy status. Is your dog pregnant or could she be? 3. Current heartworm status. Has your dog been tested recently? And 4. Overall health. Are there underlying kidney or liver issues? Answering these questions makes you an active partner in your dog's safety. The right choice is available. Take this knowledge, talk to your vet, and choose the dewormer that is demonstrably safe for the dog that depends on you.